Today. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, the Orange County Healthcare Agency reported 78 new cases of COVID-19 and 2 new deaths. Our hearts go out to the families of those that were lost. This brings our total to 1,827 confirmed cases of COVID-19 and 36 deaths to date. Despite the fluctuation of cases we have seen in Orange County, the number of those hospitalized with COVID-19 remain comparatively low. As of today, we have 158 hospitalizations and 59 in ICU, and we are starting to see a stabilization of the number of cases in this area. I understand many Orange County residents are concerned about the recent outbreak at nursing homes and skilled nursing facilities in Orange County. That is why I have asked Dr. Quick to join us today to provide the latest update on this matter. And in a few minutes, she will explain how the county is helping these residents during this time. Additionally, I would like to address an issue brought up during Tuesday's Board of Supervisors meeting. The board also decided not to close down our beaches. While we continue abiding by the statewide stay-at-home order and beach parking lots remain closed, it is important to take care of our mental health as well. We want our neighbors to be able to get fresh air and exercise. This plays a big role in mental health, which is why we encourage our residents to safely spend some time outside. The local beaches are ideal place to do so as long as our residents are properly maintaining social distancing. We can do this while also flattening the curve. Yesterday, the county received CARE Act funding $554 million from the federal government with strict guidelines. I want to thank President Trump for ensuring that this necessary assistance funding got to Orange County in a timely manner. This funding is necessary to assist our county in recovering from the coronavirus pandemic and stop the spread of this virus. COVID-19 is not far from our minds. Many Orange County residents are currently dealing with economic and emotional issues related to the pandemic, and I want to assure you that your county is working hard to assist you not just today, but also in the months to come. That is why I have launched the Orange County Business Recovery Ad Hoc Committee, along with my colleague Supervisor Don Wagner, to help assist businesses and during the recovery phase of the county's response. On Tuesday, Supervisor Wagner and I hosted our first meeting for the Orange County Business Recovery Ad Hoc Committee. We sat down with 10 participants from the business community, as well as hear medical perspectives from Senior Executive Physician Hoag Hospital, Dr. Michael Brent Zawadzki, called Dr. BZ, and Dr. Nicole Quick. The meeting lasted many hours as we discussed the first steps of finding ways to restart our economy and assist businesses as soon as it is safe to do so. The committee looked at a variety of angles on how each respective industry would be able to reopen in a safe and efficient way. We relied on the advice of our medical professionals on the call to see how we can both reopen businesses when the time is right and to do so in a way that is medically safe so that we don't risk an outbreak. I want to reiterate how important it is to get our working class employees back to work. At our office, we have received stacks of layoff notices from companies in the county, and it is the employees that are hurting the most. Today, as soon as this press conference is over, I will be attending the second meeting of our Business Ad Hoc Committee to continue the ongoing discussion of getting our hardworking businesses and their employees back to work as soon as possible. Today's press conference will feature Dr. Nicholas Quick, who will provide an update on the county's COVID-19 response. CEO Frank Kim will provide an update regarding the CARES Act funding that arrived and will also be on hand to answer any questions that you all might have. I appreciate all you joining us today and want to welcome Dr. Quick to the podium at this time. Thank you.
Good afternoon. I'm Dr. Nicole Quick, County Health Officer. At this time, we have confirmed COVID-19 outbreaks in several skilled nursing facilities and assisted living facilities in Orange County. The Orange County Healthcare Agency is reporting these case counts in aggregate form on a daily basis in our MOOC report. To view these reports, please visit healthdisasteroc.org/EMS/archive. Additionally, the California Department of Public Health is also reporting cases in residents and healthcare workers on their website, which is available by Googling CDPH Skilled Nursing Facilities. It is a point-of-time snapshot of the skilled nursing facilities in California who have reported their data within the last 24 hours. In general, when a case is identified at one of these facilities, the healthcare agency visits the facility with representatives from the California Department of Public Health to review infection control best practices. If needed, our mobile teams provide testing supplies and our public health laboratory performs testings of residents and staff. The goal is to support these facilities with resources, including staff and personal protective equipment to maintain operations. The healthcare agency has established nursing and staffing registries to support long-term care facilities, as SNFs are nationwide reporting a shortage of staff. The healthcare agency's Orange County Emergency Medical Services has established standby EMTs to support SNFs during any potential crisis. Emergency evacuations will occur with local ambulance strike teams if necessary. Long-term care facilities concerned that a resident, visitor, or employee may be a COVID-19 patient should contact the healthcare agency for consultation and guidance. Thank you.
Good afternoon. My name is Frank Kim. I'm the County Executive Officer for the county. And today I would like to share with you that earlier today we issued a press release regarding a staffing change within our healthcare agency. David Solalis, who many of you know has been our Director of Public Health within our healthcare agency, he's announced his retirement. And with that, we, on an interim basis, are placing into that role Lily Simmering, who is our Assistant Director of the Healthcare Agency. At this time, thinking about David's 16 years with the county and really the loss of that leadership and the incredible work that he did during this crisis, I am really saddened to know, but also happy for him that he'll be able to move on and enjoy his retirement and for all of the work that he's done here within the county, culminating last week with the announcement of the rollout of our community clinics. I know that in the coming weeks, you'll see quite a bit more from the county in terms of a rollout of additional testing for serology and other things that I know that are of strong interest to the community. All of that is done within the work and the foundation that was built by David, along with his staff and with Dr. Quick and the entire team at the healthcare agency. What I want to do is assure the public that while we will all miss having David work with us and the dedication and his expertise, that at the healthcare agency, we are 2,700 employees strong. And we have an incredible bench filled with our operational managers and other executives that I know and I'm very confident will be able to provide support during this time of transition. And we will quickly get on board to recruit and fill that position permanently. And very shortly, my expectation is that on Monday, we'll be announcing our new director of the healthcare agency, so that position will be filled as well. So Please understand that while we're very saddened to see David leave us, that we have a robust team within the department that can continue the fine work that he has invested in on behalf of all the residents of Orange County. And with that, I'll transition to discussion of the CARES Act. As our chairwoman had mentioned earlier, on Tuesday, we received allocation of the CARES Act in the amount of $554 million. It's an incredibly needed resource at a time when the county, like most other counties, have been utilizing their own general funds to support this incredibly challenging, resource-intensive endeavor of working through the crisis, standing up the testing, and working on all of the things that are important in terms of managing this safely for our community. That funding was also released with a guidance document, and the County of Orange is today reviewing that document in its entirety. We obviously have some questions related to the various ways in which we can utilize those funds. Those conversations are ongoing with the Department of Treasury. We'll be having those policy discussions with the Board of Supervisors, and we are certain that we will make effective use of those resources. And over the next 12 to 15 months in which we have access to those dollars, you can rest assured that we will be deploying those in a manner that is most effective to safeguard the residents of Orange County, to reactivate our businesses, and to do so in a manner that reduces as much of the risk as possible. We know that we're going to have some very difficult times coming up as we restore the economy and potentially take the risk that additional infections will occur, and our ability to have the contact tracing, to have broad scale and expansive testing, both on the infection of viruses as well as on the serology, and all of that goes with ensuring a very robust and quick and effective response to what is happening with the coronavirus 19 in Orange County, that we think this resource will be effectively used, and we intend to work with all of our partners that are first responders associated with this COVID response. So thank you for that. And with that, I'll pause and see if there's any questions from our media partners.
Operator?
And once again, you've been given the cue. It's 1 and 0 for questions. Okay, our first question will come from the line of Vicky Vargas. Please go ahead.
Hi, good afternoon. Two things. First, from Frank, this is the second department head to change in less than a month, and I know you say you have a deep bench, but is there anything we need to know about what's going on as far as the ability to handle the crisis? Did any of that come into play in changing those two who have left, Jason Austin replacing Susan Price and now David Salelas?
So understand, so when Susan Price left the county, she was working in the county executive office, not in the healthcare agency, and she went on to a promotion. She's an assistant city manager with one of our cities in Orange County, and we think that's a wonderful opportunity for her. In terms of David leaving, absolutely, he will be missed. And I'm very sorry that I don't have a partner. He was one of our team members that, every evening at 10, 11 o'clock or at midnight, we were on the phone with, working through all of what it takes to ensure that Orange County has the most robust COVID-19 response that it could have. And to have that loss and him not be available as a team member, for sure, it's going to be a loss to our department. But absolutely, there are team members that worked within David's team that are ready to step up. And as a county organization where we have 18,000 county employees, not any one of us is irreplaceable, but each of us is important. And I think we will mourn David's transition, and we will fill it quickly. And I think what you'll see is continued excellent service to our Orange County residents. So while it was unanticipated, we'll be okay. I don't think that we are worried about a lack of effective staffing and management of the crisis. I think what you'll find is that we will continue forward. You'll see more testing options roll out from the county. You'll see more clinics come online. You'll see the type of response that I think our Orange County residents expect.
Thank you. And next we'll go to the line of Chip Yost of KTLA. Thank you.
This is Chip Yost of KTLA, and my question is along the same lines, but you mentioned at the top that that you'll name a new director on Monday. I was wondering if this announcement of his resignation came in learning that he wasn't going to be named the new director. Was he up? Can you tell us, was he up for the new director, or being named the director of the job? Was he a candidate for it? And also, how do you address people who look at this after losing two top leaders or a number of leaders here during the pandemic as possible dysfunction or conflict within the department? How do you address that?
So I think number one, transition is always the case. I've worked in the county for 25 years, and every job that I've ever been promoted into came when that individual was either promoted up or retired or left or transitioned. So I think for the county, we always have movement of staff. And I think it is just particularly highlighted because it came at a time when we're in the middle of a COVID crisis, and David was a very public figure in that response. So from my perspective, it is not uncommon to see movement and transition, particularly around this time period. It's not unusual for me. I think,
was he a candidate for the job though?
So David had initially applied for the position, and what I can tell you is that before his scheduled interview, he withdrew his name from the interview process, and that was a decision that he made on his own. I had encouraged him to apply for the position.
But was the other successor already named or in line at that point when he withdrew his
No,
name?
absolutely not. The interview is completed yesterday. So I think I'd want to make very clear, there was no encouragement for us to move on from David. I wanted David to stay with the county. I thought he did a remarkable job. You have to understand that during this COVID crisis for the county, where we have been working around the clock 7 days a week for the last, I'm losing track, but it was at 45 to 50, 60 days. David was there every single day, every single weekend, every single evening. So please understand that I wanted nothing more than David to stay with us. And each individual has to make their own decisions in terms of how long they stay with an employer. And he's been with us for 16 years. I'm very grateful that he spent his time here. He's been a high-performing executive, and we're all saddened to see him go.
Thank you. And our next question will come from the line of Matthew Leslie of Fullerton Observer.
Hi. Given the special vulnerability of assisted living centers and skilled nursing centers, is the county sending anyone proactively to investigate them, inspect them, to make sure that processes are being followed that would prohibit the spread, or at least help to prevent the spread of the coronavirus in these facilities, rather than just responding to reports that there might be infections there?
Sure. Thank you for the question. I want to start out by saying that skilled nursing facilities are licensed through the California Department of Public Health, and the California Department of Public Health frequently sends out guidance on infection control in facilities. Our Orange County Healthcare Agency also spends significant time investing in infection control in facilities, making sure they understand what they need to do, calling and reminding them that if they have ill staff and or residents, that we are available for testing. So yes, the answer is we are very proactive with this group and recognize that it's a very high risk group, and we invest a lot of time and energy there.
Thank you. And our next question will come from the line of Paul Anderson of City News.
Hello. Do you have have you guys been talking about a target date for relaxing restrictions?
sometime next month? And if so, what day would that be, do you think?
I don't think that we've been talking about a specific date. We know that the governor's orders extend to the middle of May, and obviously the county's health orders expired because the governor's health orders superseded that. So we, like you, are in conversations and following the actions of the state. We expect there to be further announcements in the coming weeks from the state in terms of what their plan is in terms of a rollout for the phasing in of the businesses back into the economy. I can tell you that internally, we absolutely spend quite a bit of time and resources talking about what do our health orders look like when when businesses are allowed to reopen. And how do we ensure that we have robust testing and a response plan so that as we reintegrate workers back into the workplace, if there is an outbreak or a surge, how do we manage that? What is our capacity? So those discussions are happening ongoing, and part of that is happening through the subcommittee that the chairwoman created, which is the business recovery group that is represented by two supervisors, Supervisor Wagner, Chairwoman Steele, and then leaders in various industry groups within our Orange County business community, as well as it's staffed by our Dylan Wright, our Director of Community Resources, who's leading up our business recovery group from within the county. And Dr. Quick, who is our health officer, also participates in that group. So please understand that that discussion is happening with business leaders, with county supervisors, and with the staff that support that function.
Thank you. And next we'll go to the line of Kobe Bermel of Politico.
Yes, hi there. I have a question for Dr. Quick. Does the county envision any particular challenges with implementing its contact tracing program in the coming days, weeks, months? Are there any specifics to the county itself that might, present any issues that need to be dealt with?
Sure. So I think what we are talking about is a public health community throughout the United States, California, and Orange County is something that we have never undertaken as a public health community on this scale before. So there absolutely will be challenges to undertaking a contact investigation, tracing, and testing sort of program to this scale. I don't foresee anything specific to Orange County. We have been very proactive in increasing our staff in our communicable disease department. We are working with the state on helping develop a plan that will work, as well as ongoing staffing training to make sure that we have adequate staffing to undertake this.
And just a quick follow-up, if I may, are there any kind of particular innovations that the county has been exploring or kind of implementing, or any kind of quirks or anything special like that the county has found so far that's going to maybe help going forward?
Sure. So we have utilized some of our previous plans for what we call sort of surge. And what we mean internally for that is when we have planned for pandemics in the past, we train our public health staff to potentially have to step into the role of a into communicable disease as an investigator or a contact tracer or sort of a support staff. And what we have undertaken so far is to elicit staff from across public health and get them into these positions. Once again, back to the state plan, there are various innovative resources that the state is looking to develop, such as tracking platforms or case management platforms. We are looking at that in Orange County as well, and will be actively exploring ways that we can streamline this process. Thank you.
Thank you. And our next question will come from the line of Martin Wiskel of the Orange County Registrar.
Hi, I have several questions regarding nursing homes. And the first one has to do with Huntington Valley Healthcare Center, which is one of your two listed facilities that have had outbreaks. According to information that they have released this week, about half of their 100 or so residents are infected, and about a quarter of their staff is infected. I asked them if everybody had been tested. They said no, and I asked them why not. And I'll read you the verbatim response to that. That county public health advises who gets tested and who doesn't based on the presence of symptoms. So not everyone gets tested unless the county directs it. So I'm wondering if you could explain, in a nursing home where half of the patients are infected, why not test everyone?
Sure. So I'm not going to speak specifically to that response on the correspondence you have with that skilled nursing facility, but I will explain that anytime there is an outbreak or even a single case in a skilled nursing facility, we do investigate and test widely amongst the nursing home residents as well as staff. As to a specific occurrence as to why some individuals may not be tested, in that case, I can't speak to that, but we do offer testing widely to any nursing facility. We've always had this as a priority at our public health lab, and additionally, we will test their staff.
Okay, and on Friday, the state issued a list of nursing homes with infections, and the Anaheim Healthcare Center was listed as having 15 infected residents. They are also on your list of outbreaks. Can you tell me whether that number of 15 has moved upward since that list was posted on the state site?
Sure. Excuse me. What I can say is what I shared before, that the CDPH will be, excuse me, listing cases for both staff and nursing home residents on an ongoing basis, as will we. Hold on one second. All right, let's try that again. Thank you. So what I had stated before is that the CDPH, California Department of Public Health, will be listing cases, as will healthcare agency. So as of, and this is the latest report that I have, which is our MOAC report, confirmed cases in all of our SNFs and assisted living facilities as of yesterday was 175. That was 104 residents and 61 staff. So as far as a specific number, these numbers change all the time as we continue our investigation.
All right, and thank you. So our next question will come from the line of Tony Cabrera of ABC 7.
Yeah, I was asking about the governor and his 6 principles to get back to a regular life. I wanted to know what the county thinks, where the county thinks they're at in regards to that. How well is the county on track with those 6 principles? I don't know if you want to give it a grade, or 3 out of the 6 we're doing well on. The other 3 we have work to do. Where would you say we're at?
I'll say the county is performing well, and I think we want to be cautious because at any time you can have a large virus infection. I think the residents of Orange County have demonstrated incredible restraint in terms of managing the social distancing and limiting the manner in which they interact with each other. I know that has had an incredible burden, and I know that I hear from the businesses that are impacted, from the community members that have seen kind of reduced social interaction, that it's having an effect. But however, when we look at our numbers and we compare those to many of our peer counties, I think we're doing remarkably well. And that's a credit that goes to not only the staff within our healthcare agency that have spent so much of their time dedicated to making sure that the policies, the coordination efforts that are happening with our local hospitals and the business community, et cetera, are being well managed. But absolutely, our frontline first responders, the EMS workers, our hospital systems, all of the various components that go into having a very strong public safety healthcare response, that is in place. And I couldn't be more proud of the ambulance EMS companies, the hospital systems, the individual doctors, and our own healthcare staff. So I think all of it has come together well. And I think when you look at the infection rates, the new increased robust testing that we're putting online within the community, the serology testing that you'll hear about in the coming days, that I think we're very well positioned to open when the time is safe. But obviously, as the governor had indicated, it'll be driven by science, by data, and so we are preparing ourselves, knowing for that eventually there will be a reopening order. We expect that to start easing in May. I think that is kind of the forecast that most of us have. But again, I can't predict for you next week what the infection rate will be. So I think we're looking at this and looking at trends week over week, and we'll see what next week holds, and we'll hope that those numbers look much better than they do this week. And I think that trend is really the best guide to when we'll reopen and when we can do so safely. But absolutely, we're putting in all of the testing programs that you're hearing about because we want to be able to have that robust response once we reopen business and individuals begin to congregate again into the workplace and potentially into restaurants and other things. And we want to be ready for that.
Thank you. Next, we'll go to the line of Spencer Custodio of the Voice of OC.
Hi, this question is for the CEO, Frank Kim. I'm just wondering, the incoming CARES Act money, how will that be split up with the cities? And, kind of what types of restrictions might be on that money? It's my understanding this county is still reviewing some of the guidelines, but do you have anything to share with us today how you might be able to expect to, divvy up this money between the cities and obviously the county's response to the virus?
Thank you for that question. So the Treasury did last night around 5:30. They released guidance in terms of how those dollars can be spent. It's about a three and a half page document, and what it basically says is the primary purpose of the CARES Act is for the public health and local government response that is significantly related to the action that you had to take in response to COVID. And so what that means is that what are those new expenses, the new programs, the modification of your county government that requires resources to implement, such as new testing? What are those expenses? And those expenses generally are being supported as reimbursement. So I think your question is, how do we plan to use that money? I think number one, when you read a 3-page guidance on use of $554 million, we have a lot of questions. And I don't know that they were all addressed in the guidance document. It was really kind of a hierarchical guidance. But I think first of all, counties and cities have incurred direct expenses related to COVID. And so those costs, I think, should be covered. Two, we know that we have to stand up a robust testing network. We have to address the isolations that is required for the vulnerable population, whether they're homeless or not. We have to restore the supplies of PPEs that the county healthcare agency is maintaining within our warehouses. All of these direct responses, I think, come first. I think you've got to plan for your next 15 months. That money is available through the end of December 2020. So what are our expenses between now and then for that robust testing, the surveillance, contact tracing, serology, restoring of our inventory of PPEs? All of those kinds of things are covered. Then I think after that, there are some opportunities in there to look at what can we invest additional funds on in terms of economic and business recovery. What can we do to help businesses recover and reestablish that kind of vibrant economy that Orange County has been known for? And so we'll look at that as well. So we have different subcommittees, of which, as we mentioned earlier, the chairwoman is and Supervisor Wagner are chairing that. So we'll look at some business recovery. We'll look at direct reimbursement of costs incurred to date, and then we will build out the most robust health screening and testing network that we can with the remainder of that money. What we know for certain, it's on the first page of the guidance, is that that money cannot be used to backfill loss of revenue in the county or in the cities. So I think that is a really important item to understand, and I think we're looking for as much flexibility as possible, but that component is not eligible today.
Thank you. And our next question will come from the line of Jackie Botts of Cal Matters.
Hi, thank you. Orange County has reported 20 known cases, I believe, as of yesterday among Native Hawaiian and Pacific Islanders. It's a small number, but it does track a statewide pattern of cases and deaths per 100,000 for this group that far exceeds that of any other race and ethnicity group, and it's a group that already faces well-documented health disparities. I'm wondering to what degree the public health officer sees that as a concerning trend, and if the Department of Public Health is doing any sort of targeted COVID-19 testing or communication or public health response for this particular community.
Sure, a couple comments on that. First, I want to make very clear that with our small percent of the population falling under that demographic and the small number of deaths attributed, I want to caution about drawing too firm a conclusion simply because the numbers are small. That being said, we absolutely are concerned about disparities in testing and deaths. That is something we are looking at. We're tracking the data. Part of our testing strategy is to make sure there's equitable testing across the entire county, and that would be location, that would be insurance type and or lack of insurance. So we're taking that very seriously, and we will continue to follow all the trends across demographics and make sure that we are addressing and reaching out to those hard to reach populations for testing.
And a follow-up question, if I may, have you spoken to any Native Hawaiian Pacific Islander leaders, community members so far to sort of mobilize that outreach?
I have not personally. I would have to check back with agency staff to completely answer your question.
Thank you.
Thank you.
And our next question will come from the line of Terry Forza of Orange County Register.
Hi, folks. Thanks. And I am trying to find out more about the serology testing initiative that folks have been talking about this week. I think at the board meeting, Dr. Quick had talked about the partnership with an academic institution and 1,500 test people who will be, tested, and there's been a test that has been chosen and is being validated. Trying to get more on what that test is and how much that's costing and all that kind of stuff.
So let me give a recap on where we are with serology as a public health community. There are several approved serology tests. Quest announced this week that they now can do serology testing, and that would be an IgG test. And let me just give a brief explanation again about what that is. So when your body is exposed to a virus, your immune system forms a response. The long-term antibodies it forms is an IgG. So the test that Quest is offering is specific to that. As far as what we plan to do for the county on the surveillance test, that one is still waiting for approval through the academic institution for the IRB, which is a process we have to go through for a research test. I think that was part of the question, is what is the status of that one? So that is waiting approval on their end for the test. We also intend to be able to have serology conducted out of our public health lab. For that individual test, we have not yet received our supplies on that platform. So once we have that, we will be targeting high-risk populations, or I should say priority populations, including healthcare workers, first responders, and others. But we do hope that the commercial labs having capacity to do serology will open that up in the county.
So the Quest test then is not the one that you'll be using for the academic study?
The academic institution has a test. It is not the Quest test. Whether or not it's the same test that Quest carries, I can't answer that. Quest is carrying.
And
go ahead.
No, I was just saying, and so has the county actually bought any tests yet? That was my understanding, but that's not correct?
I think there may be, let me clarify. So the serology test is not necessarily a test that you buy. The serology test, you get a blood sample. So that would be like, for example, at Quest, you would go to a Quest blood draw site and your blood is sent off to a lab to process. So that's not a test that is bought. The county has purchased PCR test kits from a vendor, if that's what you're referring to.
All right. Thank you.
Okay,
and
you.
Our next question will come from the line of Alicia Robinson.
So the Fairview Alternate Care site opened this week, and wanted to find out, are there patients there already? If so, how many? And can you tell us where geographically they came from and sort of what type of patients? Are they, people who came from skilled nursing facilities? Are they, COVID positive homeless people who need somewhere to go, or just are there people there now and who are they?
So my understanding is that the facility was made operational on Monday, and it was available to begin receiving clients. But at least to my knowledge, we don't have any clients that are in that facility today.
Thank you.
But that's to the best of my knowledge. There could be information, something could have happened over the last day, but I'm not aware. And let me just make one clarification. I know there was a question about serology testing. Please understand that this morning we had a conversation with Quest, and they had identified their capacity to provide support to the county in terms of our need to do robust serology testing. They had identified that they could support us as a priority for up to 3,000 of these tests a day. So please understand that a lot of these conversations are happening behind the scenes, but the county is actively working with all of our major partners that do testing or provide resources such as PPEs to ensure that that capacity is available. So the capacity is available, and what we're working on now is working on agreements with our community clinics and those testing locations for the ability for those areas and those clinics to do the blood draws that can be then transferred to Quest to do the processing. So all of that is in play, and the staff are working around the clock to ensure that that is turned on as soon as possible. So couldn't be more proud of the staff and how hard they're working to provide that service to our residents.
Thank you. And next we'll go to the line of Jackie Fortier of KPCC.
Hi, this question is for Dr. Quick. We know that COVID-19 can be spread asymptomatically. We also know that nursing homes are now hotspots for coronavirus outbreaks. So under what circumstances would you test everyone, asymptomatic or otherwise, who both live and work in nursing homes in Orange County?
Sure. So in general, it really depends on what the nursing home looks like. So if you have a very large nursing home that has two sort of independent buildings, then we may not test all of the staff there. So when we have an outbreak, our highly trained medical professionals go out, make an assessment, determine who needs to be tested, who's symptomatic, and that involves talking to all the residents and looking at them. So I want everybody to be reassured that if there's potential contact with a case or if there's staff moving between that are symptomatic, those residents are tested. We have testing capacity in our public health lab to test the residents in skilled nursing facilities, whether or not they're symptomatic.
But why isn't that being done on a wide scale? I mean, what would it take for that to happen?
Well, I can reassure you that a significant portion of our cases that have been reported in the last couple days were positives from skilled nursing facilities that we have picked up in our investigation. So widespread testing is taking place.
That's not what people who work and live in the facilities are telling me. I mean, they've told me that they haven't been offered testing and they're not wearing PPE until they're even being investigated by the county. I mean, the story of what you're telling me and what is actually happening happening isn't really lining up. So I'm really wondering at what point you would test asymptomatic people, not people who have symptoms.
Sure, and how, as I explained, when we go in, if there is contact among cases, and let's say there's a roommate or someone next door to a case, those individuals, whether or not they have symptoms, are being tested. To get into specifics of a facility and the personal protective equipment that they're wearing, I wouldn't be able to comment on that on a specific case.
Okay, thank you.
And then can I also just follow up to that? Understand that I know sometimes we hear different messages from different groups. So I'll give you an example of a situation where some of this confusion can be drawn from. So when we have, let's say, a homeless shelter that had a positive COVID case, we go in and we screen all of the individuals for symptoms. We make tests available to all of the residents that are in the shelter. Now understand that it's voluntary, that we cannot go in there and require every resident to take the test. So I know that in the particular example that I'm thinking of, we had gone in and made tests available to, let's say, many people. And the majority of those individuals declined to take a test. And that is one of the challenges that we have in public health, is that on a voluntary test, do you take individuals that are in congregate living and say that if you don't take a test, we're going to exit you onto the street if you're a homeless individual? And I think that's a very difficult public policy question, and one that I don't know that I can answer to the satisfaction of each party, because there are differing views on how you manage that. But please understand that everything that I know about the county is that if there is a congregate living situation and there are individuals that test positive, anyone that is in contact with them, we absolutely, as a first priority, would offer tests to. So certainly if you have heard about institutions or programs that fall within the concern that you've identified earlier, I would ask you to contact me, because I would like to know, because those are questions that I would like to have with my staff. And I know that in my discussions with them, we offer that test broadly whenever these kinds of situations occur. And that is the right thing, and we've been doing that. Thank you very much.
Thank you. And our next question will come from the line of John Park of the Orange County Register.
And thank you so much. I believe this is the last question.
Hi, I have a couple questions on a kind of a different subject. So we mentioned a lot about nursing home, but the county has said that I think 229 healthcare workers, that includes hospitals and nursing homes, have tested positive. I think that was a couple of days ago. So does the county have an updated number as to how many healthcare workers have tested positive? And I'm kind of curious if you can just walk us through if that's disproportionate to the general population, if there's protection provided for those healthcare workers. Was kind of curious about that. I have another question, but I can wait after I get this answer.
Sure. So just to make sure I understand, you're questioning how many of our positive cases are healthcare workers at this time. If that's correct, we will follow up with you with the latest number on that. And then I'm ready for your next question.
Well, I guess what I was wondering is that if the number, whatever that is that disproportionate to kind of the general population or healthcare workers more likely to be tested positive for COVID-19 than the others? I was curious about that, and I was hoping to get that answered as well.
Sure. So in addition to getting you out that exact number that we have on the latest data, in general, from day one, we have been prioritizing testing of healthcare workers. So we have had more positives in healthcare workers because of that testing strategy initially. Are healthcare workers more likely to become exposed? That depends on what the healthcare worker is and what they're doing for work. With the number of cases right now, we are not seeing vastly increasing numbers of cases in our hospitals. Our hospitals are not overrun right now with COVID cases, but healthcare workers, certainly by the nature of what they're doing, may come in contact with sick individuals, and those individuals may have COVID-19. That is why we really, really stress having personal protective equipment available for our healthcare providers, as well as we ask healthcare providers to monitor their health, and we will test them if they are symptomatic and or had an exposure.
Sounds good. And my second question is on a different subject. I think we've heard quite a bit about the rise in anti-Asian incidents. Some of the political leaders have been speaking out about this. So I'm kind of curious, I think this is more for Frank, if the county has seen an increase in the number of anti-Asian incidents with xenophobia. Is there any action the county is taking to address that matter? I was kind of curious about that.
Can you repeat your question? I didn't quite understand what you were asking.
I was wondering if the county has seen an increase in the number of incidents of xenophobia or hate against, Asian American population because of what's been going on with the COVID-19, and if so, what is the county doing about trying to address that increase?
I haven't heard of any significant trend that I'm aware of, but that's something that I can follow up with in terms of any reports that we may have received through the Human Relations Commissions, et cetera. But and in my office, I've not heard.
Okay.
Thank you for those questions. And thank you all very much. And we'll be back on Monday.